Welcome to another edition of the Business and Personal Podcast, where we bring you closer to the people that you do business with. And real excited today to have Dr. Walter Cukrowski. He's a comprehensive ophthalmologist at the Michigan Eyecare Institute. He has more than 20 years of experience in the field, and he and I have had a lot of great conversations over the years. And I thought, you know what, it's time to record one of these. I think people would be interested in what he has to say. So, Dr. Cukrowski, I know you have a very, very busy schedule. We've had trouble getting you on the schedule, but so glad we got you on today. Thanks for joining, and how you doing?
Doing well, Ryan. Thanks for having me on. I appreciate you.
The new do suits you well, man. I haven't seen you since quarantine. I didn't even recognize you at first. You're looking good.
Hey, trying to get back in shape, getting the new look going, what have you, to hopefully spring out of this COVID lockdown.
I hear you, man. So tell me about yourself and what got you into this business, what you love about it so much, what your passions are with it.
Sure. Yes. I'm an ophthalmologist here at the Michigan Eyecare Institute for more than 20 years. I was born and raised in a family where my dad was an ophthalmologist, specializing in pediatric ophthalmology. So I really had a really bird's eye look and a very in-depth look growing up to see what an ophthalmologist does and spends their time and what they can do to help people. So that's where I kind of started from and basically grew from that and grew into it.
And what are some of the areas that you specialize in? What is your top area of expertise that you work with?
Right now, I'm specializing in cataract surgery, most specifically the laser-assisted cataract surgery using multifocal and intraocular lenses that also correct for many different problems like astigmatism and allowing people to be potentially out of their glasses 90% of the time.
And we'll talk a little bit more about some specific conditions later, but that gives people a pretty good idea of what you do. So, and now let's talk about the Michigan Eyecare Institute, and there's some exciting news. You already have a lot of locations in the market, but some exciting news about a move that's coming up here as well.
Yes, we were located in the St. Mary's Hospital for the longest time, but we outgrew that space and needed more space. So we're moving to another location over there at Schoolcraft in Levan, which is about 3 times the size of what we're used to in the hospital, with really easy access, parking, allowing also for the state-of-the-art equipment there. And we're hoping to be in there the first or second week of May of this year.
So how many locations is that in the market now? I know you have quite a few.
3 locations. We're in Southfield, Dearborn, and Livonia. And our Dearborn office, too, is relatively new. We moved to a new location, and we hope to expand that area, too.
And our listeners can come from anywhere, so you have locations in Flint as well, right?
Correct. We even had a lady come from China once a year to see us.
Love it, man. That's some reach right there.
Yeah.
So, one of the first topics I wanted to talk about, one of the reasons I wanted to bring you on right now, is the impact in so many ways that COVID has had on your business. And let's first of all start with just the business operations side and how it has impacted the Michigan Eyecare Institute, how you've adjusted now moving forward with the new world that we're living in.
Yes. Ever since the COVID happened, which pretty much hit right around this month last year, where we basically had to make some serious adjustments where we were only seeing emergency only patients a couple hours a day. We also had to close some locations temporarily to solidify all our employees and basically just follow the OSHA guidelines and all the state requirements. So we had basically a COVID-free environment for our patients to come in. So that would be the least of their worries when they came in to see us for these major eye problems that they were coming in and seeing us for at that time.
And I have to think that you're going to be setting up this year where you're going to be extremely busy, because how many people just didn't want to leave the house for a year? Their eye problems didn't go away. So people that already had eye problems, those are still there. And then others had new problems emerge. Are you expecting there to be a huge influx of need for your services this year?
Yes, Ryan, I do. And fortunately, we did have a new addition to the Michigan Eyecare Institute family, where we had a gentleman come from the up north area. I think it was Gaylord or Grayling there, where he's come and joined us and really has been an instrumental doctor helping us with the patients that we have with a full line of experience.
You had also mentioned to me same day appointments are available now. So you're really set up to meet that demand. Tell me a little bit more about that.
Yes, with all our locations and with all our doctors that are with us, we can do same day locations. We even are allowing the docs to call us directly if they want to talk about any cases before they send the patient over. Or even if someone doesn't have a doctor, they could call us immediately and we can get them in within 24 hours.
Very good, very good. Now, going back to the COVID impact on individuals and there may be eye issues that have developed, my phone tells me how much screen time I had every week. And it tracks it over the course of time. And I looked back a year ago compared to now, and certainly my time on my phone has gone way up, and I'm sure I'm not alone on that. And digital eye strain was already a big concern before quarantine hit. I think it's probably something that's even more so now. So just talk about that topic, what people should be doing to be aware of it, and some things they can do to control it.
Yes, Ryan, it's a big problem because people are spending anywhere from 2 to 6 hours on average on their phone or their computer, even more with everybody remote. So the dry eye problem is just exploding. And people who never even thought they had a problem, they're noticing at the end of their day, their eyes are burning and sore. They have to keep their eyes closed. Some people even putting like a warm towel over their eyes to hopefully relieve the pain and irritation. But there are some things that people can do to just prepare and equip themselves from getting this possible damage. And one of the most important things is just keeping the lids and lashes squeaky clean. And we really talk to people about using this OcuSoft towelette, which is over the counter, pre-medicated. It's original. It also has the plus, and then also for allergy patients, where they clean the lid lash line and they either talk to their significant other or their wife on how to clean their lids and lashes. And they gently do that in order to keep the oil glands secreting the oil that is the most important tissue, most important tear film to keep your tear film healthy on your eye. We also talk to people about starting using preservative-free tears, sometimes almost every hour when they're on the computer to bathe their eyes because of the constant staring at the screen where their eyes dry out so dramatically. We also recommend too that every half hour to an hour, people take eye breaks where they stop staring to give themselves a break. We also recommend that people look into possibly getting some special yellow glasses to use at night, but also some blue glasses during the day too, to cut down the UV rays that you're getting from the computer. So those are some basic things that really help people. And then people that are even suffering even more so, we recommend like a special gel to use, like a Refresh PM or Sustain Liquid Gel, which they can buy over the counter to put in their eye before bed so they don't wake up in the morning and reopen the wound, so to speak, of this ocular surface disease.
Yeah, I just don't think it's realistic to say, hey, get off your computer and don't ever use your computer again, or go down from 5 hours a day to 1 or 2 hours a day. That's just not the world we live in. We need these devices, but it's good to know there's easy things that people can do to counteract the problems that can occur. And you know what? We're already using hand sanitizer and being extra clean in so many other areas. What's cleaning your eyelids? What big a deal is that to kind of add to the mix, you know?
Correct. And another thing too, Ryan, it's so easy too. If they come on in and they're having a problem, we can go over everything. We can check their osmolarity of their tear film and basically tweak it to their own unique way and problem that they have. And there's other medications too that we can order that would help to relieve the patient of this burden, because this isn't going away. If anything, it's here to stay and it's going to get worse.
So, you know, anybody that's experiencing dry eyes or anything along those lines, I think it would be a great idea to set up an appointment with Dr. C or one of the docs at Michigan Eyecare. It's an easy problem to be fixed. So now people are going to be getting outside, Dr. C, right? Been stuck inside all year. They're going to be getting outside in the summer sun way more this year. Sunglasses, right? No brainer.
Totally.
No
Totally,
brainer.
Ryan. And the best thing is too, is if they come in and see us, we can get them prescription polarized wraparound sunglasses that not only will give them the best vision whatsoever, but also protect them from the UV rays. Because we found out 80% of your sun exposure is done after age 18. So even if we get the children going with these glasses, that will be such a big improvement. and protect them in their later years in life.
Absolutely. Just simple advice, but not, some people take sunglasses for granted and don't realize just how important they are.
Yes. And even our contacts too. We have a lot of people that wear the one-day contacts and they have UV protected lenses. Then on top of your sunglasses, you're getting even double protection. So there's a lot of things you can do to really protect people.
Absolutely. Well, let's talk about cataracts, because I know you really wanted to cover this topic. And just about everybody runs into issues with cataracts at some point in their life. It's kind of a wide open question, but educate people about cataracts, things that they can maybe do to avoid problems with cataracts, and then what treatments you do have if they do arise.
Yes. As much as we're talking about prevention, we're talking about treatment and correction. Prevention, one of the biggest things, wearing those sunglasses. If you're diabetic, keeping that sugar so well controlled with the help of your doctors. Also, of course, wearing protective eye gear too from any job that you might be doing that could possibly damage your eyes, like the welders, the people that are construction, who accidentally get hit in the eye, accidentally, that causes a traumatic cataract. So there's so many things you can do to really prevent cataracts. But one of the most important things is talking to people who smoke, and the 1-800-QUIT SMOKING. We talk that sermon almost each and every hour when we see our patients. And it's really helped a lot of people, because smoking creates so many problems with the eye, let alone the cataracts that people get from smoking at an early age.
And it's good to know that you have procedures to cure problems with cataracts, and we'll talk about that in a little bit. But what would be a trigger for someone? The key is catching it early, of course, just like anything else. So what would be a trigger for someone that they are starting to have problems with their cataracts, so then they should get that appointment early and get it taken care of?
Good question, Ryan. One of the biggest things that we find, people who have their glasses well-tuned, well-managed, and what have you, but are still complaining of difficulty driving at night, seeing street signs, the oncoming headlight traffic, seeing their TV, doing the one-hand salute where they check one eye followed by the other and they notice a difference. Those are the people that we recommend come in, because it could be something we could easily treat and cure to get that vision back to perfection, hopefully. That's what we aim for. So those are the big things, just to know for sure if you're having a difficulty or even an early problem, to come on in and get evaluated, because it may be you don't even need any cataract surgery at this time. You may just need some glasses, and maybe we just need to monitor it and also push a little more prevention to see if we can put it off for a while, because 9 times out of 10, the cataracts we see are purely elective that we need to remove. Very rarely do we see the ones that you got to remove and you're going to lose your sight. So I think people can really overcome any fear or trepidation to see the eye doctor.
And the surgeries, it's a pretty common procedure now. So just tell people how effective it is and how quickly they can recover from it.
Yeah, it's an incredible procedure. I was trained by so many people across the world. One of my friends in Japan, who's one of the stellar surgeons of our century, I spent some time with, and along with so many others who have been such a great influence in my life to become the surgeon who I am, we're able to do these procedures anywhere from 4 to 15 minutes for a common cataract. However, we don't stop there, because right now, with the industry changing so much to being so high tech and perfection, we're doing now a fair amount of cataracts with laser treatment in order to get the most perfect steps of the cataract down and get the best outcome for the vision. We also have so many people who don't want to wear glasses, and we can, with a 90% certainty, get people less dependent on glasses. Even my mom came to me and she had her cataracts done, and that was over 15 years ago, and she's still without glasses to this day.
It's got to be so rewarding to help people out that come in with those issues and just see a major difference right after the surgery like that.
It's incredible, Ron, because you know what? I used to be in landscaping, and I really got so much joy, enjoyment, and fulfillment after doing landscaping and lawn maintenance, seeing what you do. But it's so amazing when you have people come in the next day and they're ecstatic and they say, "Doc, you changed my life." And I said, you know what? God gets the glory. I'm just going to be his hand.
I love that. Well, what else? You've given some great advice for people here, and we could probably go on for an hour or longer with all the different things. But what are some things maybe you're seeing a lot of, some typical conversations that you have with patients, just maybe general advice, or it's kind of an open forum for you to say what's on your mind about anything else that we haven't covered.
Yeah, I think a lot of people are really concerned about the coronavirus and how it affects the eye and how to be cautious and careful. And I think right now we're doing it, washing our hands, not touching our eyes. If you have to touch your eyes, use like a Q-tip or sterile gloves, what have you, but try to avoid rubbing your eyes. And then also wearing the protective eyewear anytime you can. Even if you have perfect vision, it's just good that you're wearing some good sunglasses outside. We have some people too that have great vision who just are used to wearing glasses with no prescription because they like the look. So I think it's one of the biggest things right now is just to dispel any myths that are going on, but also do the protective measures so people don't get a problem with their eyes due to COVID-19.
Start good habits at a young age, and that is going to delay issues, hopefully, that you have with your eyes later in life, right?
Yes, so true, Ryan. And that's one thing too with the diet, the exercise, wearing the sunglasses. People who have diabetes and high blood pressure, they see their eye doctor at least yearly to make sure we could catch things early to prevent. But then also too, a lot of patients are over 65 that are losing central vision. There's things we can do with our retina staff to basically prevent and possibly even treat and hopefully in our lifetime cure to prevent any central vision loss.
Well, I know you got a lot of great stories, Dr. C, from all your years in this industry. What's maybe either a funny or heartwarming or uplifting story that you'd like to share?
Yes, I have a couple, but one that hits my mind right at this point is I remember one time going to my church, and my parents go to this group which is called Faithful Friends, and I was able to meet some of their friends and what have you. And one of my parents' friends that I didn't realize at the time they were friends, that he came to me long ago to do his cataract surgery, and he came up to me and reminded him. I remember my patients mostly through facial recognition, and most of the time I remember their name, but a lot of times after you do their cataract surgery, you may not see them again because they just figure everything is okay and don't come back, right? And he came up to me and said, listen, you did my cataract surgery. And then he was then talking to another friend saying, hey, you should go see him, which kind of was a delight, but also a shock because you just never know, what happens and who you meet and what have you, and how sometimes things go round robin, hopefully in a good way.
Yeah, what a great testimonial for what you do right there. And I'm sure there's many others you have to share, but maybe we'll get you on another time to do those. But I want you to close here to let people know how they can get an appointment with you or somebody else from the staff, including these same day appointments you were talking about. What's the best way for them to get on the schedule?
Yeah, Ryan, I think the best thing would be to call Michigan Eyecare Institute at 1-800-676-3937 or visit our website, misheyecare.com, and contact us directly. And if they're having any problems, they need that immediate appointment, we'll accommodate them any way we can to help them and hopefully be a blessing to their eyes.
Okay, I need to kind of log off from this podcast and give my eyes a little break here, Dr. C. So, but I do appreciate you coming on and giving some great info.
Hey, I sure appreciate you too, Ryan. Keep doing the great job you're doing.
All right, take care.